And I thank you so much for being here. Alpha Kappa Alpha Sorority Incorporated set aside the day in February as Pink Goes Red. This is one of the few days in the a month of the year that I wear red for an extended period of time. As you know, we love our pink and green. In support of American Heart Association, during the month of February, the sorority brings awareness to the seriousness of heart disease in women as we it brings awareness to the seriousness of heart disease. As women, we know that heart disease is one of the leading killers. Well, heart disease is not good for women. So we need to take care of ourselves, take care of our bodies, and we need to develop good eating habit and exercise. Today, I had the honor of presenting to you two of our chapter members, sorors, sisters, and friends who will work with us in ways to keep our bodies, who will give us ways and suggestions on keeping our bodies healthy. And also, I have their bios here, and I'm just going to be brief in giving you the bios for our presenters for today, who are Dr. Sheila Belton Gaiman, who's one of our chapter members, and soror Sandra Randolph. Dr. Sheila Belton Gaiman is a native of Augusta, Georgia. She has spent most of her adult life in Columbia, South Carolina. She started her career in the healthcare field in 1985 as a nursing assistant, where she was enrolled in a high school program where she was able to get a degree as a nursing assistant. She has worked long-term, she has worked in long-term care facilities until enrollment in college. She attended Oxford College of Emory University, where she obtained an associate degree of arts in 1987. She proceeded on to the University of South Carolina and obtained a Bachelor of Science degree in nursing in 1990 and a Master of Nursing degree with emphasis on family nurse practitioner, which is a special track. And she did this in 1995. In 2007, she graduated with high distinction from Chamberlain University with a Doctor of Nursing practice degree. Advanced practice leadership is her specialty. She has presented many scholarly projects. She has been a board certified family nurse practitioner for 26 years, and she has worked in various arenas to include family and pediatric practice. Currently, she is a visiting professor at the as a visiting professor in the nurse practitioner program at Chamberlain University, and an adjunct professor in the nursing practitioners program at South University. Her greatest achievement is being a co-owner of Ivy Health Solutions, LLC, which is a new nurse practitioner association where she is a primary owner in the healthcare industry here in Columbia. On her personal life, Dr. Belton Gaiman is married to her husband, Reginald, and they have 4 adult children and 1 grandchild. She attends Temple Zion Baptist Church, where she is a minister in the healthcare team, she's home team minister leader. She's also a Tamiokas for the Delta Eta chapter of Chi Eta Phi Sorority Incorporated. And she is a member of the Sisterly Relations Committee in our chapter and the Bylaws Committee. On to Dr. Sandra Randolph. Dr. Sandra Randolph is a board certified family nurse practitioner with 28 years of experience in various practice settings, which include family, pediatrics, substance abuse and mental health, addiction and mental health. She earned her Bachelor of Nursing degree from Clemson University and her postdoctorate degree, which includes a master's in nursing, postmaster's certificate in nursing, and Doctor of Nursing practice from the University of South Carolina. She is also the co-owner of Ivy Health Solutions, a nurse practitioner-owned practice providing primary care services here in Columbia. She is also practiced in Lexington, Richland Alcohol and Drug Abuse Council, and is an adjunct professor at South University. In addition, Dr. Randolph is a life member of Alpha Kappa Alpha sorority, and she's an active member of Sigma Theta Tau International Honor Society of Nursing, Capital Nursing Practitioners Group, and Psychiatric Advanced Practice Registered Nurse Group. She is married to William Randolph and has one daughter, Victoria. Let us let's take time now to listen to our soror sisters and friends as they present to us on how we can take care of our bodies. Thank you. And you all can proceed, Dr. Randolph and Dr. Belton Gaiman.
Good evening, sorors. We'd like to thank you for this opportunity to present during Heart Health Awareness Month. Now, sorry, Tammy, do I have control? Let's see. Okay. All right, can you all hear me?
Yes.
Yes. Okay.
Yes, yes.
All right. Okay. It's not advancing. Sorry, Tammy. Okay. Let's try this again. All right. All right, so heart disease is the leading cause of death and disability in the United States, accounting for 630,000 deaths per year. In South Carolina, it's the leading cause of death as well. And in 2018, 10,460 South Carolinians died from heart disease. Heart disease is the #1 cause of death in women, and this is followed by cancer, chronic respiratory disease, stroke, and Alzheimer's disease. In 2017, women represented almost 50% of the deaths from cardiovascular disease. African American women represented 32.6% of this number. Oops. My apologies. It jumped to the other screen too soon. Okay. Okay. I'm sorry. I'm having a little bit of difficulty with technology. Okay, so 32% of African American women fell within this group. 31.8% of Asian women fall within this group, 30.3% of white women, and then 28.5% of Hispanic women. So as noted in the previous slide, heart disease is the leading cause of death in African American women. And this holds true in South Carolina as well. African American women are at increased risk of ischemic heart disease and stroke. And this is related to the fact that 76% of us are overweight or obese, 45% of us have hypertension, and 34% of us have high cholesterol. Stroke is the third leading cause of death in African Americans in South Carolina. And so 52% of African Americans have a greater chance of dying from a stroke than our white counterparts. Coronary artery disease, with the acronym of CAD, is the most common cause of heart disease. And this is caused by atherosclerosis, which is really just a big word for a buildup of fat in the blood vessels. So if you look here at this normal artery, the vessel is patent, and so blood should just flow through this vessel without any problem. But when you look at this picture on the right, you see this yellow plaque formation. And so lipids and cholesterol build up in the blood. It forms this plaque. There's a remodeling of the blood vessels, and then this creates an obstruction so that blood doesn't flow as freely through the vessels. A decrease in the blood flow then leads to a decrease in oxygenated blood to vital organs in our body. And this is particularly true, of course, with heart disease, so that what happens is the heart either doesn't function like it needs to, or what can also happen is it can become necrotic, where that particular part of the heart in which the blood is deficient in the amount of oxygenated blood that goes there starts to die. So that part of the heart muscle starts to die. So this obstruction and narrowing of the arteries is what can lead to a heart attack. It can lead to an arrhythmia, which is an irregular heartbeat. It can lead to angina, and this is where persons will have chronic chest pain because of that decrease in blood flow to the heart, and it can lead to heart failure. And this is where the blood or the heart is not able to pump blood adequately throughout the body to meet the demands of the body. So there's several risk factors that increase our chances of having heart disease. High cholesterol, a family history of heart disease, especially premature or early heart disease. And this is where someone has had a cardiac event or has died from heart disease less than 55 years of age. Being overweight or obese, a sedentary lifestyle, smoking, hypertension, diabetes, stress, advanced age, all of these are risk factors for heart disease. Now, some of these risk factors we can't do anything about. We can't change our age, we can't change our genetics and the family history that's been passed down to us. But most of these risk factors are what we call modifiable. They're ones in which we can change or at least control the risk factor. So if you're a smoker, you need to seek help to stop smoking. If you have a sedentary lifestyle, then you want to become more physically active. If you have diabetes, high blood pressure, high cholesterol, you want to control these diseases and not let the disease control you. All right, so some signs and symptoms of a heart attack. The most common ones are chest pain difficulty breathing, nausea and vomiting, sweating, and indigestion. Now, chest pain can happen for different reasons. It can be a cardiovascular problem, such as a myocardial infarction or a heart attack, but you can have chest pain from a gastrointestinal problem like acid reflux, a musculoskeletal problem like inflammation in the chest muscles can cause chest pain, and even anxiety. Some persons' anxiety is so severe that they'll have a panic attack and make them feel as if they're having a heart attack. But even though you have these different reasons for chest pain, the number one reason that you want to rule out first would be a cardiac issue. So if someone is complaining of chest pain, shortness of breath, then you want to go ahead and call 911 and activate emergency medical services to start immediate medical attention. Now, other signs of a heart attack can be pain in the abdomen, back, jaw, or the neck. Persons may complain of feeling lightheaded or weak, or they may complain of feeling tired and fatigued. Women and the elderly may have what we call an atypical presentation. So women don't always complain of chest pain. Sometimes women will just complain of shortness of breath, jaw or back pain, fatigue. And sometimes I've heard some women just say they just didn't feel good. The elderly don't always complain of pain either. Or if they complain of pain, they'll say something like, oh, it's just hurting a little bit. And that's because as we get older, our pain perception is altered. So an elderly person might present not with chest pain, but with shortness of breath or dizziness, fatigue, or they may just be confused. So keep in mind with the elderly and women, they may not always have that typical or that classical presentation of chest pain and shortness of breath when they're having a heart attack. All right, so here's a question for you all. Sugary beverages should be limited to how many per day? And anybody can answer.
One.
Right.
One.
Correct. Yeah, we should limit our sugary drinks to 1 a day. All right. All right, so one of the things that we can do to decrease our risk of heart disease is to eat healthier. So we should be eating more fruits and vegetables, more whole grains and lean protein, and we should be eating less processed foods, sodium, fat, and sugar. The 2 or more sugary beverages per day can actually increase our risk of heart disease by about 38%. So we want to eat healthier and be more intentional about what we put in our bodies. There's actually some studies that show that the extra sugar that we take in causes inflammation in the arteries, weakens the artery walls, and then that, of course, puts us at more risk of heart disease. So instead of our caffeinated drinks, the sodas and the sugar-filled juices and our specialty coffees, we need to be drinking more water. All right, so we should keep in mind that all fat is not bad. So we actually do need fat or cholesterol for cell membrane formation, as well as the development of the lining around our nerves. But we want to eat more of the healthy fats. So we should have 2 to 3 servings a day of nuts and seeds, fish, eggs, healthy oils like coconut, olive, and avocado. But we need to avoid or at least reduce our intake of the fatty meats and margarine, cheese, pastries, donuts, deep fried foods. All right, so again, healthy eating is one of those things that we have control over and we can do in order to reduce our risk of heart disease. So I'm going to turn this over to Dr. Belton Gaiman, and she's going to provide us with some more tips for a healthy heart.
Dr. Randolph, I'm just going to ask that you go ahead and advance the slides since we're running short on time. Good evening. Dr. Randolph has provided the statistical and pathophysiological overview of heart disease and has discussed some healthy eating tips. I will now discuss additional tips for a healthy heart. We will first begin with physical activity. Statistics show that only 1 in 5 adults get enough exercise to maintain good health. That means that most of us are missing out on the benefits that being active provides, such as lower risk of heart disease, stroke, and diabetes, as well as improved sleep, cognition, weight loss, and fewer symptoms of depression and anxiety. It is recommended that we get at least 30 minutes of moderate intensive activity 5 days per week. You may wonder, what is considered moderate intensity activity? Activities such as brisk walking, water aerobics, dancing, gardening, playing tennis, and biking are considered moderate intensity activities. With these activities, your heart will beat faster and you'll breathe a little bit harder, but you should still be able to talk. Don't worry if you cannot reach 150 minutes per week. Start off easy. The simplest way to get moving and improve your health is to start walking. Set a reachable goal, work towards the recommended goal by increasing the time as you get stronger. Any amount of time is better than none. 5 or 10 minutes here and there throughout the day really adds up. Remember to move more with more intensity and sit less. The next tip is to stop smoking and to avoid secondhand smoke. Smoking harms almost every tissue or organ in your body and increases your cardiovascular disease risk. It is never too late to quit. With 1 year of smoking cessation, your risk of coronary heart disease drops by 50%, and after 10 years, your risk is as low as that of someone who has never smoked. There are a lot of resources available to help you quit. Talk with your healthcare provider about your options. The next tip is to consume alcohol in moderation. Moderate alcohol consumption reduces your risk of disease by 25% by increasing your HDL, which is your good cholesterol. On the other hand, drinking too much increases your risk for high blood pressure and heart disease by raising your triglyceride levels. The combination of high triglycerides, high bad cholesterol, low good cholesterol can contribute to the buildup of fats in your arteries. That in turn increases your risk for heart attack and stroke. So what is considered moderation? For women, 1 drink per day is considered moderation, and 1 drink is 12 ounces of regular beer, or 5 ounces of wine, or 1.5 ounces of 80 proof spirits. Remember to drink only in moderation, if at all. The last tip on the slide is to decrease your stress. Everyone feels and reacts to stress in different ways. Stress causes your body to release adrenaline and cortisol. When you are under increased or constant stress, these hormones remain elevated, which puts you at increased risk of many health problems, to include anxiety, depression, digestive problems, headaches, heart disease, sleep problems, weight gain, as well as memory and concentration impairment. Stressful events are a fact of life. Therefore, you must take steps to manage the impact they have on your life. Learn to identify what stresses you and how to care for yourself physically and emotionally. Next slide, please. Another strategy to having a healthy heart is to engage in regular checkups. Let's start with blood pressure, which is one of the most important screenings for monitoring cardiovascular health. High blood pressure usually has no symptoms, so it can't be detected unless it's measured. Blood pressure screenings begin at age 18 and is recommended annually at age 40. The goal for blood pressure is 120 over 80, below 120 over 80. If your blood pressure is higher, your doctor may want to check it more often. Untreated high blood pressure can lead to heart attack, heart disease, and stroke. High blood pressure can be controlled through lifestyle changes and/or medication. The second screening on the slide is blood sugar, blood glucose screenings. High blood sugar levels puts you at risk of developing prediabetes and type 2 diabetes and can lead to heart disease and stroke. Blood sugar screenings begin at the age of 40 for those with no risk factors. If you are overweight or have 2 or more risk factors, your healthcare provider may recommend a fasting blood sugar or glucose test. A normal fasting blood sugar test reading should be between 70 and 99. A reading between 100 to 125 would place you in the pre-diabetes range, and a reading greater than 125 would place you in the diabetes range. Your healthcare provider may perform additional testing to confirm the diagnosis. Lower your chances of developing diabetes through lifestyle modifications. The last screening on the slide is cholesterol screening. Blood cholesterol is essential for good health, and your body makes all the blood cholesterol it needs. Therefore, it is recommended that you eat as little dietary cholesterol as possible. It is recommended that women without risk factors begin cholesterol screening at age 45. Screening is recommended at age 20 for those with risk factors. Normal results are a total cholesterol less than 200, an LDL less than 100, a HDL greater than 40, and triglycerides less than 150. In addition to lab results, your healthcare provider may calculate your 10-year risk of experiencing cardiovascular disease or stroke. Like high blood pressure, often cholesterol can be controlled through lifestyle changes and/or medication. Next slide, please. Here is your next question. Please read the question, and if someone would like to answer.
Yes.
Yes.
That's true.
Yes.
Next slide. Absolutely. Poor dental hygiene can increase your risk of heart disease. Research has shown that bacteria in the mouth can move into the bloodstream and cause an elevation in C-reactive protein, which is a marker for inflammation in the blood vessels. These changes in turn increases your risk for heart disease and stroke. Therefore, maintaining optimal oral hygiene is an important part of your overall health. Next slide, please. We will end the presentation with sexual and reproductive health tips. The human papillomavirus, or HPV, is one of the most common sexually transmitted infections and are responsible for cancers of the cervix, penis, anus, and back of the throat. Recent studies have linked HPV to cardiovascular disease, with reports that HPV may encourage chronic inflammation in the body and contribute to atherosclerosis. Decrease your risk of exposure to HPV by practicing safe sex and using a condom. Also maintain regular gynecological checkups and speak with your gynecologist to see if the HPV vaccine is an option for you. Lastly, be sure to choose your birth control wisely. Research has found a link between birth control pills and an increase in blood pressure, a decrease in good cholesterol, an increase in bad cholesterol and triglycerides, and the development of blood clots. These changes are more likely to occur in women who are overweight, have kidney disease, or have a family history of high blood pressure. The combination of birth control pills and smoking can be dangerous and is not recommended as it increases the risk of heart disease. Consult with your primary care provider to discuss your options. If you remain on birth control pills, have your blood pressure checked every 6 months to make sure it remains in a healthy range. Next slide, please. This is your final question. Please read the question and give me an answer.
Monday.
Absolutely. Next slide, please. Monday increases a woman's risk of heart attack. The explanation centers around the circadian time. On the weekends, we tend to stay up later than usual and sleep in the next day. As a result, your master clock gradually delays over the weekend in response to the delayed light-dark cycle. On Monday morning, you're forcing your body to wake up early, which causes a circadian misalignment, resulting in higher blood pressure, elevations of inflammatory markers, and changes in nervous system function, which makes you more vulnerable to heart attacks. Therefore, decrease your risk of sticking to a regular sleep pattern and dim the lights about an hour before you sleep. Next slide, please. Those are the references. And do we have any questions? Hearing no questions, next slide, please. We wanted to give you all some information about Ivy Health Solutions here in Columbia, South Carolina. We're located at 4100 North Main Street, Suite 201. And if you would like to become a part of Ivy Health Solutions, if you know someone who's looking for a primary care provider, we are open for business. And we certainly appreciate your time this evening. Thank you.
Thank you so much, Dr. Gaiman and Dr. Randolph. We appreciate you taking the time in to come and talk with us about Heart Health Month. It is very important that we know how to take care of our heart, and it's great leading into what Target 2 and the program committee has come up with to increase not only the education of heart awareness, but also challenges to, start thinking of ways to decrease our health. Decrease our weight, increase our health with healthy eating, and also challenging us to work out. So thank you so very much for sharing your knowledge with us and expertise. And we look forward to hearing more, especially as you guys venture out into private practice, and hopefully some SARS that are looking for a new doctor would definitely seek you out. So thank you so much.
Thank you.
And I think with that, we are running into chapter meeting. So Tammy, I'll turn it back over to you and James Zetta.
Live it up, live it up, live it up, live it up.